have been active my entire life, and as I've gotten older, peak performance and longevity have only become more important. Along that journey, people have asked me a lot of questions. When people hear terms like testosterone replacement therapy, NAD, or GLP-1s like Ozempic, the conversation jumps to extremes. Hype on one side, fear on the other. Stress, broken sleep, digital overload, metabolic wear and tear. Most of us feel it before we can even name it. And that's why I brought Oscar on. He's an advanced practice nurse and co-founder of Smooth Aesthetics, a clinic that's dedicated to adding years of vitality to your life. Today, we're having an honest conversation about physiology, aging, and what it really means to stay healthy in today's world. Welcome to the Alpha Renaissance with Oscar Leyva. What is NAD?
So NAD stands for nicotinamide adenine dinucleotide. It's a vitamin B3 derivative. And what it essentially does is it helps give your cells the building blocks to have excellent energy centers, your mitochondria. So it helps repair and replace the weakened mitochondria so that you have the strongest energy producers that you could have. So yeah, it has a lot of different uses. So, back in the 60s, it was used for schizophrenia.
Get out, really?
Yeah.
And I know that.
Yeah. And, it worked pretty well. And, but it was hard to patent. So, Big Pharma needed a pill that they could patent.
Was just naturally occurring in your body.
Right. So, it kind of fell out of favor. And then in the 80s, it was used in treatment centers for alcohol withdrawal.
Interesting.
So people would check in and, walk around with NAD drips infusing for 8 hours a day.
Get out.
Yeah. And, most recently, it started to be used for, for high functioning people because it helps with athletic performance. It helps with mental focus. It helps with creativity, anxiety, depression. These are all some of the indications that people would choose to use NAD.
I never knew about the schizophrenia treatment and what it was used for in terms of withdrawal. Is it still has some clinical efficacy or usage these days?
Yeah, absolutely. It helps to reduce cravings. So, we have several clients that are withdrawing from, different kinds of substance abuses, and they choose to use NAD to help them with that.
Often NAD gets touted as the fountain of youth drug.
Right.
People, is not just internal revitalization, but also there's, an aesthetical perspective of taking this drug. Is that also one of its benefits?
Yeah, aside from it giving you a ton of energy, it also helps with fat burning as well. So it could help you look a little leaner, a little slimmer, and it's great. A lot of people call it the anti-aging or age reversal agent. So it's great for that as well.
Yeah, I will say too, when I first started taking it, right, I started to feel satiety, right? Like I started to feel, I didn't have food cravings. And I would notice that, especially right after an injection, I felt like I was just a little bit more under control in terms of like what I desire. Which even though I've pretty much been working out, a healthy eating person most of my life, for me, cakes, cookies are always like very difficult. We have a child in the house. You have these things in your house, so I'm always creeping up, to the pantry for a little
snack.
Yeah, and I noticed I wasn't doing that as much when I was taking it. Is it any kind of effect on appetite at all?
Not necessarily appetite, but definitely cravings.
Yeah.
So that craving for the cookie. I had this one client who told me that every night before he goes to bed, he would take a shot of tequila. just every single night. And after his first dose, he was like, I went for that tequila, took the shot, and it tasted different. Like
Wow.
it tasted bad to me.
Yeah.
It's the same tequila he's been drinking every single day, which
Interesting.
probably isn't the healthiest thing to do anyway, but he just couldn't take it. Like it tasted gross to him. So I think he said that he switched over to a bourbon.
A bourbon and NAD.
Yeah. But it definitely helps with cravings. So
is that when people usually feel a shift like that soon, or what's the average amount of time? Because often I'm sure someone wants, if they're going to start taking it, because it's not cheap sometimes, right? When should someone expect to feel a difference?
Yeah, a lot of people hope to feel the difference after their first infusion, which from my experience, it's not that way. Typically, after the third to fourth dose is when people start to get that light switch moment where they're like, oh, I feel different. I have an extra gear.
Yeah.
And typically people will notice it in their workouts or with their sleep. They might be getting some amazing sleep.
That was something I noticed, was the sleep as well. Sleep
really
was good.
Right. And that helps everything.
Yeah.
If you can sleep well at night, I mean, it helps a lot of other functions.
Yeah. And I was getting REM sleep as well, because I was definitely having vivid dreams. So that was a noticeable difference.
Yeah.
For me.
Yeah. So typically about the fourth dose is when people notice it. And typically what we do is we do 5 treatments in a 10-day period for loading. We want to saturate the body with NAD. And then after that, we will typically do monthly infusions.
So you have a specific protocol? Yeah. Like, how did you get this protocol? How do you, what goes into creating a protocol?
Yeah. So I was so blessed to work with Dr. Craig Conover out of Charleston, South Carolina.
Wow.
And, he's, the man.
Yeah.
NAD, done thousands of them. And I used to work with him and all of his clients here in Austin. So yeah, he shared that with me, and he was responsible for this NAD revolution here in Austin. I mean, we've helped so many people, doing the NAD protocol.
Yeah, no, I saw him on the Huberman Lab with and him and Dr. Conover. It was amazing. One of the best episodes that I've ever seen. And he was just like on the cutting edge of every single peptide and NAD. He is the man for sure.
Yeah, and he was just so great in showing me exactly what he wanted for all of his patients, and it was awesome to work with him.
So is your formularies, is it all IV? Are they oral?
No, we only use intravenous NAD.
What about sub-Q? Because from what I understand, some clinics inject sub-Q.
Yeah, no, that's not something that we do, but it's very popular.
Okay.
Smaller doses, typically about 100 milligrams injected subcutaneously. But yeah, no, that's not what we do.
And on average, how much dose of NAD are you receiving IV?
We typically will infuse 750 milligrams of NAD.
Yeah.
In a one-time go.
Okay. And is that average, or do you do more?
No, it's always that.
Okay.
It's always that.
Okay. Good. Yeah, that's interesting. Yeah, it's like people always ask me about NAD, and I'm just so happy to have you on, because I try to explain it and they're like, NA what? So it's a lot of misconceptions out there about it. What are some of the big misconceptions about NAD that you've heard?
People think it's a relaxing IV.
Okay.
like when you get an IV, you're like, oh, you're hanging out, you're just feeling refreshed and relaxed. NAD is actually really tough to receive. Typically, there are a couple of things that happen while you're receiving it, and everyone's different. But for the most part, what people will notice while they're receiving NAD is, for me, for example, I get sinus pressure. So like my nose gets really stuffy, just like I'm having an allergic kind of hay fever type reaction. Also, I can feel an anxiety in my chest. So like I could feel my heart beating very loudly. And like a nausea, almost like a burning in the stomach, which is really uncomfortable.
Totally.
As well as like heaviness in my arms and legs, almost like someone's trying to pull
a heavy blanket is on you.
Blanket, that's a good way to describe it. Yeah. Also, like if you're sore anywhere, NAD is going to kind of amplify that.
Yeah.
So it's not a relaxing type of IV. Like it's actually a lot of work.
Yeah.
And it can be a challenge, but it's okay to be challenged.
I mean, when I first started receiving NAD, I would grab my laptop and I would say, I'm going to have an hour or so to sit down, and I'm going to have to sit down anyway. I'll get some work done. And then I noticed like the higher the density of the attention that I needed for my work meant that I would really feel the symptoms from receiving the NAD infusion. Like I would get really tired, or just like really, just like light, like kind of like flustered. I would feel that anxiety, the congestion in my nose. I would feel that, the heart racing. I would feel that, and then if I just stopped, even like thinking, just tried to relax, I would calm down.
Yeah.
So it's like even like whatever catecholamines were like rushing through my body, based off of what I was looking at, I could feel that doing the infusion.
Yeah, and it affects people differently. Yeah. I had this guy, he would just open up the NAD all the way open, and he would lead conference calls.
Yeah.
Like actually lead a meeting during that. Whereas when I do it, I can't even talk to you. Like I can't speak. I can't, all I'm doing is focusing on getting through the treatment. Other people, they kind of want to be distracted. So if you notice during some of our NAD sessions with our friends, some people are chatty.
Yeah.
Other people are kind of quiet. So my job is to help our client to get through it. So whether that is engaging in a conversation or staying quiet or a mixture of the two, that's my job, is to help coach them through that treatment so that they can get through it, because it's not easy.
Yeah, no, totally. So what do you see NAD for a person that wants to live a life, life-changing, or start like a healthy lifestyle? They already are living a healthy lifestyle. Where would you compartmentalize NAD in terms of what benefits it would give to you?
So like NAD is great. It's great for energy. It's great for athletic performance and mental focus. So if these are some of the things that you're looking for, NAD can have a huge benefit for that. It's expensive, like you said. So that unfortunately is a barrier for a lot of people. But if this is something that is within your budget, it's just an awesome tool to help optimize, the way your life really, like in all facets, right? But there are other things that are also helpful with optimization. So making sure that you're sleeping well, for example, that doesn't cost anything.
Yeah.
Eating well, exercising, all of these things can have huge impacts. Reducing alcohol intake, not smoking. I mean, these are all no-brainer type things, but do we do them all?
Sounds easy, right?
Yeah, it does sound easy. But so NAD is great for a lot of people. Some people, they can't tolerate needles.
Yeah.
I've had people who, I put the needle in, and then they look down, and then they just pass out. They just pass out.
Bagel down.
Yeah, they bagel down. And, so there's just, it's not always an option for a lot of people.
NAD often gets conflated with IV therapy. How it just IV therapy is just it's a huge umbrella term, right? You guys do have a lot of IV therapy at Smooth Aesthetics,
right?
How is NAD the same or different from IV therapy?
Well, so IV therapy, like you said, is a broad term. It's delivered intravenously, so that's how it's the same.
Yeah.
Right. And it has a very specific function, right? But there are other types of IV therapies that are not NAD. For example, if we went to ACL this weekend, right?
Right.
So what do? Oh, let's all get IVs.
Yes.
To help boost our immune system. So this is something that we did. Me and my friends, we got together. We did IVs before the festival, so that our immune system was on maximum, right? So this includes like high levels of vitamin C, so mega doses, right?
Yeah. What would be a mega dose of vitamin C?
Yeah. So what we used is 15 grams.
Wow.
So
15 grams.
Those emergencies, I think they're 500 milligrams or 1,000 milligrams. So imagine taking 15 of those, or the equivalent of 24 gallons of orange juice.
Well, yeah, I mean, you would lose so much of the bioavailability with vitamin C. So you don't even get, say you get 500, you don't even get.
You'd physically be unable to even consume it. I mean, you'd be drinking orange juice all day long.
Why such a large dose of vitamin C IV?
Well, you can even take more.
Wow. I didn't know that.
Yeah. You can take, up to 100 grams, 200 grams. It becomes more difficult to tolerate the higher the dose.
Is it similar to NAD infusion?
No, not like that.
Only NAD.
No, it'll make you feel kind of buzzy, or maybe a little lightheaded, especially if you go too fast. But
buzzy, like you had like a drink of alcohol.
Yeah, just a little shaky.
A little shaky.
Yeah, okay. No, not intoxicated.
Okay.
But yeah, adding zinc, B12, B complex, and then of course, it's hot, so like some fluid, a liter of fluid, that's super helpful.
Yeah, fluid. So
keep you hydrated.
So obviously people going to festivals, but what is the prototype? Who should be taking IV hydration?
So pretty much anyone that wants to benefit from receiving vitamins and minerals intravenously. Like you said bioavailability. What does that mean? Well, when you take a vitamin and you swallow it and it sits in your stomach, your body tries as hard as it can to extract as many nutrients from that vitamin. But unfortunately, it's just not an efficient way. Like we get at the most 20% of what's actually in that vitamin when you take a supplement.
Yeah.
So when you administer things intravenously, like you would in the hospital, you get almost 100% absorption. So
totally.
So everything that we're putting into the IV, your body's able to receive it and benefit from it. So it's just a superior way to administer, these things.
Wow. And then, so even like when you're doing the NAD, are you just do people just typically receive the NAD, or are they receiving vitamins or any other medicines in that session?
So typically the NAD is done by itself. I've seen some places that, will add a whole bunch of things to the NAD.
Like glutathione.
Yeah. Glutathione, which is great. It's great by itself.
Totally.
In fact, I recommend glutathione for so many people, just not at the same time as NAD, because it binds free radicals. So you don't want to bind NAD because you're going through all this discomfort. Yeah. And if it's not all being, administered, then you don't want to waste any of it. So, so NAD should be given by itself.
So in a clinical setting, how is that different from a lot of these places where they're just like literally IV hydration, right? Like why would a person go to, say, like a clinical setting versus like an IV bar? Mm-hmm. What's the difference in what you would expect?
Typically, clinical settings, like, for example, if you're at an infusion center, they are able to administer things that, are maybe a little more dangerous, right? For example, I get requests all the time. Can you administer iron? We always say no. And the reason being, it's not that I haven't. We have in a clinical setting.
Yeah.
But when you're, in a community or in an IV office, there's not typically, crash carts, for example. Like if
just in case
somebody's
emergency.
Yeah. So for example, if somebody were to have a severe allergic reaction, you need to have, the tools necessary to be able to resuscitate them. I mean, of course, you'd call 911.
Yeah.
But you want to be able to treat them. So typically, med spas, and IV bars, things like this, they don't infuse dangerous, products, things that can cause, someone harm.
Yeah, totally. So it's just a little bit more of like
it's just safe.
Yeah,
super
just safer,
safe,
quicker, just things that you're not going to an IV, like a small IV clinic unconnected to a hospital for anything that's
antibiotic administration.
Yeah, we're not doing that.
No.
We're not doing any
intravenous nutrition like TPN, nothing like that.
Exactly.
No,
exactly.
No, it's just water soluble vitamins, minerals, and amino acids typically.
Yeah. Well, I also too know for IV hydration clinics, everyone asks me for an IV, and it's usually related to hangover treatment. Like people, like
done lots of those. Yes.
Everyone always asks me for like an IV to help them after they've been out. Does it cure your hangover? Because that's what everything that I see online says. Oh, you get an IV, is going to cure it the next day.
Yeah. Yeah.
Yeah.
Pretty much. Yeah. I remember one of my buddies, we were doing a fantasy football draft.
Yeah.
Right. And he had overconsumed the night before. And during the draft, I looked over at him and he was just like, he was dying. Like he looked awful. He was gray, just not making good decisions. So I interrupted the draft and I'm like, hey guys, I'm going to run home. I'm going to bring some supplies.
Stash.
I'm going to give him an IV. Helps with this headache.
Yeah.
So many people have a headache, when they are severely dehydrated, which is what essentially a hangover is.
Yeah.
We can also improve nausea. Okay. And
treat it directly.
Yeah. Treat it directly. So, the two things that you need when you're severely hungover is fluid, and this will help with headache and nausea. We can add some B vitamins like vitamin B12, B complex, and this will help with energy. The one thing it doesn't cure is fatigue, though.
Yeah.
Right. Usually, when you're out and about, you typically don't sleep as well because, when you're intoxicated and you try to sleep, you just do not have restful sleep.
Yeah, totally.
So, you'll still be sleepy, but you'll definitely feel a lot better.
Yeah, it's not like a 100, like everybody will be different, but more or less you're going to get some benefit from having hydration because you've been dehydrated.
Right.
Yeah.
Right. And typically, like I remember this other girl, we did a bachelorette party.
Fun.
Right. Yeah. Yeah. So it was the morning after the bachelorette party. And I walk in and there's this young girl and she's vomiting,
when you walk in.
As I walk in. So I point to her friends and I'm like, you bring her over to the couch. So they drug her over to the couch.
Yeah.
Started her IV. And for her, we gave her 2 liters of fluid because she needed extra. She's been vomiting.
Yeah.
She just needed extra fluid,
totally
right?
Dehydrated.
And by the time we started the second bag, you could just see her coming to life. And then towards the end, she was asking for a mimosa. So I was like, okay, so she obviously feels better.
She was back.
Yeah, she was back.
What about those like IV hydration packets?
The liquid IVs?
Liquid IVs, yeah, primarily.
Yeah, a lot of people like them.
Yeah.
So any kind of hydration is good, right? If you can, if you're drinking, if you sub 1 round with a round of water,
Yeah.
I mean, it's going to help.
Yeah.
Right.
Okay. So it is some benefit.
Yeah.
To the oral packets and taking. I mean, you just need to hydrate. As long as you hydrate in general.
Yeah, you're drinking water.
Yeah.
So I mean, it's always good for you.
Yeah, totally. Well, switching to another hot topic that you love a lot, which is GLP-1s. Right? You guys do a lot of that in your clinic. Is this just a fad? Or is it GLP-1s like the real thing?
Oh man. For the longest time, if you're heavy or overweight, and you went to your doctor, they would say, well, go on a diet.
Yeah.
Go work out. And, there just wasn't a tool. This is a tool. Just like, if you're in pain, you take some Tylenol and you feel better. If you're heavy and you need a tool to help you with that, GLP-1s can really help a lot of people. And we've seen it in our office. We've seen people completely change their lives. And what I love about them, not only has it changed my life, because I've been on them for almost 3 years.
Oh, wow.
Yeah.
What were you taking them for, if you don't mind?
Yeah, no, I was overweight.
You were overweight?
I was overweight. And I worked out.
Yeah.
And I thought I ate well.
Yeah.
But I did not. It just gets hard, right?
So you started taking it three years ago?
3 years ago in January.
Wow.
So we started New Year's resolutions. We gave up alcohol and we started doing, the semaglutide, which is the generic version of Ozempic.
Yeah.
And it changed my life, and what I'll say that I noticed is really the main thing is it helps you feel full with less food.
Yes.
Okay. So when I talk to people about it, I always use the taco example. I'm like, hey, so imagine you go eat tacos and you can always eat 2 tacos and then feel absolutely stuffed. So imagine when you're eating now, instead of 2 tacos, you can feel full with 1.5 taco, just less food. Okay. So smaller portions, but you still feel satisfied.
Yeah.
So it's not even like you're suffering really, because, when you feel full, that's when you stop eating. So we're just listening to our bodies. And many of us were trained to clear our plates.
Yeah.
My mom, I remember her making me sit at the dinner table for, I think, 2 hours after everyone had left because I just didn't want to eat.
We grew up in a really food insecure culture where, food is the one thing that you're always given. Say if you're a child and like you're misbehaving and you go on punishment, you go on timeout, whatever. Like you can always say, Mom, I'm hungry. You're gonna get fed, right? Mm-hmm. Even in jail, right? You can threaten like a hunger strike, and you're gonna get fed, right? So under the worst conditions, you can eat in most places, right? Mm-hmm. In most situations, and that I feel like that's just something that's just like really drilled into our brain because I have a friend. Like anytime we would go somewhere, anytime we would go on a trip, he would always worry about food. Like always worry, like when is the next meal coming? He didn't know that he did it until like we actually talked about it. But every time we could be somewhere, okay, I need to get 1 meal, and just in case, because we're traveling, I don't know where the next meal is coming. I like this food. I'm gonna get 2 meals from this place. And so you just this constant, just like food insecurity.
Food noise.
Yeah. And like, did you have that when you were taking GLP-1s?
Yeah, well, so it helps with that noise, that obsessing over food, the thinking about food all the time. We don't typically snack immediately after dinner.
Yeah.
And why is that? Because you feel satisfied. So when you take these GLP-1s, you feel satisfied for a lot of the time. So much so that, I kind of have to put myself on a schedule.
Yeah.
Because I'll not think about it or I'll forget.
So you have to force yourself to eat pretty much.
Not force myself because I want to eat, but I just have to remind myself. I'm like, hey, it's time to eat something.
Do you feel, so if you don't eat, how are you feeling? Are you feeling like low blood sugar? Are you feeling like faint?
Yeah, sometimes I'll get a little jittery if I don't eat. One of the things that many people notice when they take this medication is nausea. Okay.
Interesting.
But it's not like nausea like, oh, I'm hungover or I ate bad food. It's really more similar to hunger pain. So when people feel nauseous on this medication, I always ask them, hey, what did you eat for dinner last night? What did you eat for breakfast? What have you done for lunch? And if they go back and they really think about what they've eaten over the last 24 hours, they've probably just not eaten enough food.
Interesting.
So the solution is what? Oh, well, eat something.
Yeah.
Eat something. And it goes away pretty quickly after that.
What about, I mean, even as an anesthetist, I've seen people come in, right? Because GLP-1s for us is a big deal if you're coming into surgery, right? Because GLP-1s decrease gastric emptying.
Right.
So that's bad if you're going to have surgery. We need your stomach to empty. It's a big risk for aspirating, gastric contents to your lungs, which can kill you, right? Do you ever see any side effects related to that where people feel that sensation of fullness in their stomach, or there's an overaccumulation of gastric contents?
It does increase your acid production. So a lot of people will feel some GERD, some gastric reflux, which is usually managed by, Mylanta. Yeah. In the moment, Mylanta, if it's something that they struggle with on a daily basis, then something like that could be helpful. What we see a lot of is constipation. People can become constipated on this medication. So while they are on the medicine, we tell them, hey, you have to pay attention. Pay attention to your body. Listen to your body. If you haven't gone to the bathroom in a couple of days, maybe it's time to take something to help with that.
Is it any way you can kind of watch that in the sense of, like, should they schedule themselves to go to the bathroom and poop, ever so often? Is it something that you just don't feel that you're constipated until you're constipated? You don't have the desire to
people
have a bowel movement?
People forget.
Yeah.
People just don't pay attention. Like, what I'll say is that because you're going to eat less, you're going to produce less waste.
Right.
That makes sense, right?
So less sensations that you're
right. So like if you skip a day, even though you're like a normal everyday kind of person, like you might skip a day, right? And that's okay. But if you're like on day 3 and you haven't had any kind of bowel movement, then it's time to, take action, like be deliberate with your activity to make it happen. Yeah.
You can't be Napoleon, right? He was famous. I don't know if it's real or not, but he was famous for only pooping once a week.
Oh, really?
Yeah. This was like a big thing. So I don't know.
Those army camps, it must have not been comfortable.
Well, it was Ozempic. He had it back then.
Yeah.
1800s taking an oath.
Yeah. No. So we just have to pay attention to our bodies when we do these things, and like really keep track and make sure that we're not just letting things happen to us, because we're being intentional, right? If you're trying to lose weight, things that will make it work better is listening to your body. Oh, I'm feeling weird. Oh, I probably need to eat. Oh, I haven't gone to the bathroom in a couple of days. Oh, maybe I should do something about that. And what we do while we take the medicine is super important. A lot of people think, oh, I only need to take the shots. I don't need to exercise. Well, that's not true, because most people will take the shots a couple of months, get down to their desired, weight goal and then stop. How are you going to maintain that?
Yeah.
If they're able to create healthy habits while they're on the medicine, like eating better food, like exercising, it becomes a lot easier to maintain.
Well, this goes into the philosophy of this drug and why some people have issue with it. There's the entire community that feels like you shouldn't be able to just take a pill and it gets rid of your problems. Like there's no pill you can take and it just fixes you. Mm-hmm. You have to actually, like, what got you there, right? It's behavior, right? Your eating habits, So taking a pill, it puts a Band-Aid on the issue, but if you still have the same eating habits, you're just going to gain the weight.
Right. Yeah. We've had people that, will take the medicine And then I'll ask them, well, how's it going? It's like, oh, great. Like I'm, eating less food, it's helping with that. And I'm like, well, have you lost weight? I'm like, no. I'm like, well, what are you drinking? Oh, I drink sweet tea. I drink, Coca-Cola.
Sugar.
Yeah. Sugar drinks.
Sugar.
I'm like, well, your calories are coming from that.
Yeah.
So, these are all things that, we need to, emphasize and have people pay attention to, because this is a reset button, and it's just a tool like any other tool. If you use it properly, it's going to work.
Yeah, it totally, like, with Ozempic in general, like like you said, it's a tool. Like, you still can have issues where you're actually not losing weight, particularly with beverages. Beverages in general are just such a huge fat adder. I mean, if you eliminate beverages from your soft drinks, basically, if you eliminate those from your diet, you can lose 20, 25 pounds like overnight, literally.
Some people just need to do that.
If you just stop drinking soda,
right,
juice, anything with the flavor, just drink water for like 1 month.
Isn't that weird?
You will lose weight. It's like it's night and day.
Right. Yeah, 100%. I mean, and these are the kind of habits that we are trying to create with our clients that are starting to use these medications. So
how do you because this is difficult, because I look at it now as like food is way more complex than it ever was, right? It's not, our parents, right? They ate mostly at home, right? They were the generation that started to, popularize, McDonald's and fast food, but still, like, there was a huge contingent of them that really prepared their own foods, right? And then, if you're 30s, 40s, you kind of just born into this world where we grew up going to fast food, right? And the ingredients are complex. I mean, if you look on the back of any label, no one knows what this stuff is. Not the average person, at least, right? And then even the strategies for, should I fast? Should I do this diet? Should I, try active, whatever, right? How do you start changing your diet? Like, what's a good place to just start?
Well, you have to be intentional.
Yeah.
Right? You have to try. Most people don't try. It's so easy to get food. Yeah, it's so easy to be overweight. It's way easier to be heavy than it is to not be heavy, because people are busy. People work a lot. It's easy to swing by a fast food place and pick up, what you need, or Uber Eats. It's so easy to just get food delivered to you. It's a lot harder to prepare your food and be intentional about it. So, I mean, it's not easy. Like, it's really not easy.
Yeah, you have to actively educate yourself. And even for me, like, I probably had like some genetic where it was easy for me to lose weight, and I never really gained weight. I was always pretty much like a slim person, but sometimes slim, like that slim fat person as well, right? I could eat whatever I wanted, and I didn't really gain. And then when I actually, in my 30s, I started to gain weight that I didn't want. And it took me to actually like start looking at labels and counting my calories. Counting calories for me was like the most transformative action I ever took in terms of like managing weight, because it forced you to like actually look at everything you're eating, and then you're like, oh my God, ketchup has like, this packet of ketchup has this many calories. All these little things that you think you're telling yourself like, oh, I watch what I eat. But if you're not actually counting what you're eating, you're not really watching it. You're guessing about what you eat. We all eat way more than we think we do.
Right. And many people have a weird relationship with food. For many people, growing up, it was an incentive. Like, oh, you did good on this test. Let's go get some ice cream.
Let's get some pizza. Yeah.
Let's get some pizza or whatever. Or, the opposite. Hey, you did not eat all of your food. You're going to be punished. So we have a weird relationship.
Stay at the table
food.
and eat this food.
Yeah. It's not just nutrition. It's very personal. Like our holidays, Thanksgiving revolves around food. So, it's super important. And, people as we get older, it becomes harder to lose weight. Like I struggled with losing weight, and I would exercise and I would justify, oh, I can eat that because I worked out today.
Yeah, I burned 500 calories
Yeah,
today.
I crushed my Orange Theory workout. Yeah, I can definitely, eat this.
Yeah.
But like I just kept gaining weight, a pound or two a year. 5 years later, you're like 10 pounds heavier than you were 5 years before that. And it just keeps going on.
It happens slowly.
And we just buy bigger clothes or,
Yeah, you do. It's slowly.
We just buy, and you keep your old stuff just in case, you can get back into it.
The closet doesn't lie, man.
Yeah.
It's always like hilarious because if you're like, I just bought this last year and I can't fit into my thighs are really thick in these pant legs that I bought from last summer. It's definitely doesn't lie to us.
Yeah. Yeah. So really we're just helping people, learn about these tools because that's all it is. It's just a tool.
In terms of side effects, like one time I recommended to just a friend, I was like, you should maybe think about taking Ozempic. He told me, he was like, I don't want my heart to shrivel up. What happens to your muscle mass on Ozempic?
Yeah, well, it depends. How many people will lose weight too quickly, right? So on average, about 1 pound per week is what's the safe amount.
Totally, yes.
Right. So like,
and that's even if you're not taking Ozempic right away. Anytime you hear about, these people that are like doing these cleanses where they're like, oh, I lost 10 pounds doing this juice cleanse. And you're like, you're not supposed to lose, first off, it's water weight, but you're not supposed to lose weight that quickly. You're supposed to lose weight gradually.
Yeah. Yeah. So, losing weight in a controlled way, in a monitored way, 1 pound per week, 1.5 tacos instead of 2 tacos, just a little bit less tacos.
Only
every
1.5.
time, whatever it is. That's the way. Making sure that you're eating enough protein is super important, right? Because we don't want to be skinny fat people, like you said.
Yeah.
We want to be skinny fit people, so making sure that you don't lose muscle. At our office, we actually have an in-body scale that allows you to measure how much your muscle mass is.
Yeah.
So as you come for more injections, like you step on the scale, you can not only see the number on the scale, which is important to a lot of people, but more important, your fat percent.
Yeah.
Your fat weight and your muscle weight so that you can see where am I losing the weight? Is it in my muscles, which is not good, or is it in the fat, which is what we want? We want to lose fat. So definitely there's so much more to weight loss than just the actual number on the scale.
Yeah, I look at, like I always tell people, and even patients, right? Like a scale, like we look at it, gives us a headache, and that's kind of what it is, right? Like it's like a symptomatic headache. You can have a headache for anything. Having a headache doesn't really tell you nothing, right? You can have a headache from stress. You can have a headache from some complex disease, right? That's what your weight on that scale tells you. It just gives you a general number like, hey, you're just going in this direction or you're going in that direction. But we don't know exactly why. So like in-bodies are amazing.
Yeah.
It's amazing that you guys do that.
Yeah. I mean, it's important to have all the information. When I was really like, in my weight loss journey, there was a month or two that I just didn't lose any weight, like on the regular scale. And I'm like, man, what's going on? I'm eating good. I'm exercising really, really good. My clothes fit better. I look better, but I'm the same weight. Yeah. I'm like, oh, let me use the scale, the in-body scale. And turns out I had lost like 3% body fat since the previous time. And I had gained muscle. So even though my weight was different, my body composition was different. So if you're only looking at the number on the scale, it could be discouraging.
Yeah. Totally.
When in reality, there's so much more that you need to look at.
Yeah. And same thing when I was doing bodybuilding, like your body is changing, right?
Right.
And you look slim. You can see your abs. You can see all this definition. And then you get on the scale and it's like, you gained 5 pounds. You're like, what? Like I'm doing cardio, I'm lifting, I'm in top tier shape, but it's the body composition, which is telling a totally different story than the number on the scale.
Right. And for most people, that's all they think about is the number on the scale, when in reality, that's not, the most important thing.
Yeah, tough one, man. And so are there any cardiac effects that you're aware of with GLP-1s?
No, not that I'm aware
like
of.
Negative cardiac effects.
No, I think if you're eating properly and just eating a little less tacos every single time, it's a really safe medication. The side effects, if you're able to manage those and stay on top of those, and not let your constipation turn into like a 10-day thing where you haven't gone to the bathroom and now you're having obstruction issues or something like that. I think it's a really, really safe medication and something that not only is here helping a lot of people, but is going to continue to help people in the future. They're finding that when people lose weight, and I see it all the time. My clients will come back and say, "Oh, my numbers are better." On their lab work. My doctor reduced my blood pressure medicine because I've lost so much weight. I don't need to use medication anymore, or I'm no longer pre-diabetic because I've lost the weight. These things. I'm not snoring anymore.
Totally.
Sleep apnea is a huge problem. And what happens is as you lose weight, you all the extra tissue in your throat, like it shrinks down as well, and people are sleeping better as a result as well.
How much weight do you lose when you started taking Ozempic?
I've lost 40 pounds.
Wow.
Yeah.
And over how long?
It took me about a year and a half, maybe 2 years to get to that.
Yeah.
But in my journey, and I started exercising more.
Yeah.
So now I'm a half marathoner.
Nice.
Which I never thought that would even be a goal for me.
And future marathoner.
And you're right. I am training for a marathon in December. So,
but you never thought you probably would have done.
Never.
Yeah.
Never. I thought I was just an old guy, an old fat guy, who, I should have done it in my 30s.
Yeah.
Regret. And, losing the weight, first of all, it's a lot easier to run when you're 40 pounds lighter.
Totally.
Yeah.
Better on your joints.
Yeah. I mean, that's another thing that helps. The less weight you carry, the more happy your joints will be. But yeah, you can definitely do things that you just never thought that you wanted to, that were even possible because you're a different person.
I always tell people that are overweight when they're struggling, I'm like, hey man, even if you are not attempting to get better, you don't feel good. And you don't really even know you don't feel good sometimes, right? Overall, just what it does to you for your confidence, right? Like you didn't think you could even compete in a marathon. You thought you were an old guy. And a lot of that came from weight insecurity, right? You don't feel good if you're that big. I mean, you just don't. And if you think you're okay, you're not. You're just not. Like just even from a psychological standpoint, not what it's doing and beating down your body and the stress it's putting on your cardiovascular system and your joints. You just psychologically, it's taking opportunity from you. And subconsciously, you acknowledge it, but you don't really, you don't accept it, right? Mm-hmm. So it's a very interesting transformation that you have. I'm happy you were able to do it with whatever tools you had at your disposal.
Yeah, confidence is a huge part of it. Like you just feel better. Like you just feel better about yourself. There's so many people that I talk to who are just unhappy.
Yeah.
They're unhappy with their weight, So if you're happy with your weight, that's great, like good for you. Not everyone is in that space. So, we have, I have a client who her daughter is getting married next weekend, and she texted me the other day and told me how she fit into the dress that she envisioned for her daughter's big day. So it's really, really cool. And I see so many amazing stories every single day of people meeting their goals and really accomplishing things that they maybe at one time thought were impossible.
even from an aesthetic point of view, when you see someone and they look quote unquote old, most of the time it's because of weight gain. Like when they like weight ages you so poorly. And using things like semaglutide or GLP-1s, it really helps you just to look younger. When you lose the weight, you just look so much better. It keeps you youthful.
Yeah. Yeah. And more importantly, it keeps your body youthful.
Totally.
Right?
Yeah.
Like I said, sleeping better, all the metabolic changes that will happen, as a result of the weight loss, reduction in inflammation, all these things, as we know, are super bad for your body. So yeah, I mean, it changed my life. So I'm happy to share it with other people as well.
With the GLP-1s, do you recommend any hormone replacement therapy?
Well, those are two separate issues, right? But hormones, I mean, I love hormones. I tested myself in my 30s and I just didn't feel great. I'd get home from work, I was exhausted. I just didn't have any energy left. Libido was low. I was grumpy. I was depressed. I was anxious. And I got my testosterone levels tested and I was normal. I was at 324. Okay. Most labs will say that testosterone levels for men are anywhere between 300 and 800. So I was 324. So I was normal. Great. But really there's not much of a difference between 324 and 299.
Yeah.
Okay. So I was not optimized. So rather than being on the low end of normal, I was able to get my testosterone replaced using BioT pellets, which are these pellets that are inserted under the skin and they dissolve over 6 months. So you get a consistent testosterone level. Mm-hmm. So instead of being 324, now I'm 900.
So, okay, to put this in perspective, what would a teenage boy, an 18-year-old teenage boy, or I guess that's a man.
Yeah.
What would their testosterone level?
Well, I mean,
average?
It depends, right?
Yeah. Raging bull.
It depends, but
yes.
The replacement levels are similar to what you felt like in your 20s.
Yeah.
Right. So, it just changes your life, really. I've had clients who we're looking for products like NAD. They're like, oh, I'm depressed. I want to start NAD. I'll be like, well, let's check your hormones. Let's try that first because, we're looking for solutions, not Band-Aids, right? So if you have, optimized hormones, it can help with so many things. And it's really a game changer for a lot of people. And most people, they just kind of accept, oh, well, I'm just getting old. Like, this is just what it's like, but I don't want to feel like my dad did when he was 47, which is how old I am now.
Yeah.
There's tools that I can take, that I can use, like hormone replacement, to help me feel awesome. And that's my goal, is I want people to feel awesome. And, checking your hormones, making sure that, you might be normal, but are you optimized?
I can definitely relate to what you're saying. Like for myself, it hit like mid 30s, late 30s. I definitely started to feel a change where I was exhausted all the time. I was drinking so much coffee, and I noticed one day looked at myself, why am I drinking so much coffee? Why am I drinking so much energy drinks? And it was a noticeable difference. Had my levels checked, same thing. It was like 273, low end of normal. And my general practitioner were like, why do you want to check your testosterone anyway? Like, like it's normal, it's okay. But I didn't feel okay.
Right.
I didn't feel okay. And it was just, and also too, I think there was a cultural component where like, growing up on the south side of Chicago, like somebody taking, testosterone, that's steroids, right?
Oh
which
yeah.
is like, oh, you're taking steroids. It's this pride in being quote unquote all natural, right? Like, oh, it was looked down upon. And I grew up very like athletic. We played football. My brother, we wrestle, we track, all of those things. So it was definitely like looked down upon to take any type of hormone replacement therapy. So I was psychologically against it. And it was never, I was never even a thought. And then I literally just started feeling so bad. I started taking it, and man, it was like night and day. It was night and day.
Yeah. Yeah. And you're right. There's a lot of people, especially a lot of men, who are opposed to it, because it makes them think that, oh, they're less than whatever. Right. Which is ridiculous. Like yes. Is it normal as you get older for your levels to decline? Yes. Do we have to accept it? No, we don't. Like, once again, it's another tool that people use to help you feel awesome. So I am all about it for sure.
Yeah. And we're not talking about like the underground, like trend, D-ball. Like, we're not talking about the stuff because it gets associated, especially like for guys, it gets associated with this rage, right? Like, if you start taking testosterone, you're gonna be that guy coming into the gym ready to fight and just angry. And I never felt like that. I never felt angry.
Yeah, well, your testosterone levels weren't 3,000 or 4,000.
Exactly.
Right. They were.
And I wasn't on other anabolic steroids in conjunction that came from China.
Exactly. They were controlled.
Yeah.
Right. Which is what you want. You want your testosterone level to be optimized, right? Not necessarily like something that you're not training to, beat people up or something like that. So, I mean, if it's controlled, I mean, it's a blessing for sure.
Yeah.
And I remember COVID, my provider shut down. They're like, nope, no more testosterone for you. And it happened to me right as I was due. So for about 8 months, I had to go back down to my prior level, and it was miserable. Like it was really, really hard. So luckily,
it was, I had a disruption in my supply as well. And it was the brain fog for me was the most, like, you do feel like you're 21 years old, by the way. And that goes in every direction, right? But you also have that this just kind of just like, you're there, you're present. You're a lot more present than you were without it. And you don't, obviously this is a gradual change that men feel over time. As a matter of fact, there's a testosterone, hypotestosterone epidemic. Like many men today have low T. We don't know why it's happening, but many men have low T. And it's like, okay, we have this issue. Obviously we need to get down to the bottom of it. Simultaneously, there are therapies for it.
Right. And there's natural things too that you can do. Once again, sleeping. Yeah. Getting 7 to 8 hours of sleep can help boost your testosterone. Having normal vitamin D levels can help. When we test people, almost everyone is low on vitamin D. Yeah. That could be a supplement. That could be, spending time outdoors, getting some vitamin D, through sunlight.
Yeah, especially where I came from in Chicago, everyone has vitamin D deficiency.
Yeah, everyone's indoors.
Yeah.
Exercising can help. Eating good food. These are all things.
Lifting weights, actually.
Lifting
really
weights.
Good for T production.
Lifting weights. So there's things that you can do to help boost your own testosterone naturally. But then again, that'll take you as far as it's going to take you. And then, some people will need to supplement. So
is there anyone that shouldn't be on testosterone replacement?
No, I really don't think that there is anyone that should be. Now, if, there are some people that do get excluded, many men with, histories of prostate cancer, they should definitely get cleared before, pursuing that. So speaking with their healthcare professionals to see if this is something that they should do. But like hormones, testosterone, it's naturally occurs in your body. So So it's not like you're taking, some weird medication or something that your body naturally doesn't produce. You don't develop these things, when you're a teenager. Like, you don't all of a sudden get sick because your testosterone is too high. No, it's part of your body. It's part of who you are.
And yeah, the TRT that we're talking about is not coming from your gym bro in the bathroom,
From a guy.
Yeah, from a guy. Like,
guy.
It's actually like you're getting this from pharmacies, reputable pharmacies.
Mm-hmm.
You're getting tested. We're checking you for polycythemia. Well, we're checking your PSA, your prostate.
Mm-hmm.
We're checking your labs, checking your cholesterol. Right. It's controlled. Like, you're under the care of a clinic.
Right.
And you're being monitored for signs of danger, when you may need to come off of it or what have you.
Right. Yeah. What we see often is people's blood gets really thick. So, hemoglobin, hematocrit could be elevated. And, at that point, hey, it's time to do a good deed and go donate some blood.
Yeah.
Go save a life.
That's the cure.
Go donate some blood. Yeah. I mean, that's all you have to do.
Yeah. Yeah, it's amazing. And then also, even if one thing people are always afraid of is, I had a guy, he was a cop, and this guy literally had a scar on his face, and he was still like a Chicago cop, right? And I shouldn't laugh at him, but he was needless to say, he was a tough guy. Like, he didn't take any shit, okay? And he was deathly afraid of being injected. Like, he hated needles.
Yeah.
He would go to the clinic once a week to have the nurse inject him. And I used to tell him, I was like, God, like, you gotta be kidding me. Like, you're one of the toughest guys I've ever met. So what do you say for guys that they'll literally be afraid of needles, and this is the reason why they won't seek therapy, even though, like, that shouldn't stop them?
Yeah. There's creams. You could put a testosterone cream. So if you're absolutely opposed to needles, there's other ways to get that. So that might be a good option for him. Pelleting is for men. Testosterone pellets, something you need to do once every 6 months. So that might be also a good solution for somebody who doesn't want to go in on a weekly basis to have something done to them. So.
And what type of procedure is that? Just kind of go in to a clinic.
Yeah. It's a sterile procedure. You basically insert some pellets underneath the tissue, and they live there for about 6 months. And it's numbed up. It's a short recovery time, so you'll feel sore for a couple of a couple of days, and then after that, there's nothing else to do. So it's very low maintenance. So there's not a whole lot to do with that one. So that's a great option for a lot of people who don't want to fuss with something on a daily basis.
Yeah. Well, man, Oscar, we've covered a lot of ground. Time just kind of like evaporated. In closing, when you hear people, attack this era that we're in an era of biohacking, right? First it was treatment. We were just trying to stay alive in human history. And then it became prevention. We developed vaccines and antibiotics to fight disease. And now we're hacking into every aspect of human existence that we can.
Mm-hmm.
Some people believe that's a cop-out, right? They believe that, you know what? You just need to have discipline. You shouldn't rely so heavily on pharmaceutical therapies, right? And some of that too, I can understand, right? Like, I'm not saying they're even completely wrong, right? What are your thoughts?
Well, I mean, I've been blessed to have met so many really smart, interesting people, right? And you learn something from a lot of them. Formats like this, like podcasts, allow people to be introduced to new ideas. If you've never heard anything about testosterone, maybe after today, you might be like, oh, maybe I should get tested to see what my levels are at. So these are all just tools to help you feel better. Like, I'm not interested in growing old, and feeling like an old guy just yet. I want to live my best life. You know, I still feel young. I still want to do things. I've got a marathon in a few weeks.
Yeah.
You know, I've got stuff to do still. And, you know, these tools are just helping me accomplish my goals. So if you don't want to participate, you know, good for you. Like it doesn't impact. What's great nowadays, though, is that we are able to learn so much from so many other people in a much easier way. Whereas before, the only time that you would even think about testosterone is if maybe your primary care physician would mention it. You know, and even they, depending on what their attitude,
a lot of them,
might be like, "Oh, you're fine, you're normal.
You don't need that." Yeah,
you don't need that.
Yeah.
I'm like, no, I feel awful.
Yeah,
So,
I do feel like it's a part of it. It's like a shaming people because the individuals that were in great shape could always use that as a flex, right? Against those that weren't, like, look at you, fatty, you don't have any discipline. You don't want to get better. Look at me, I have discipline. So it was a way to social signal how, you know, what your status was and how important you are and how smart and dedicated you are to something positive.
Yeah, I actually, when I was running the half marathon, I saw someone holding a sign that said, "This is not an Ozempic body." And I'm like, damn. Like, no, I worked really hard.
Yeah.
Like
Even with testosterone,
it's shaming. Yeah.
You know, people, you don't just grow muscle. Like, you still have to go work out.
Right.
Okay. I know plenty of people that have taken testosterone. You would never know because they don't really have that many muscles. Okay. And if you're not working out, you're not just gonna have muscles. You're not gonna turn into Hulk Hogan overnight.
Yeah, it definitely requires the work. This just gives you the energy to be able to, you know, make changes.
Yeah. Awesome. Thanks again for your time.
Thank you.
Appreciate it.
So nice talking with you.
Same.